name is Oluwakemi Ibulubo. So I'll be talking to us on neonatal nursing support, ensuring safe transition at birth. And my focus will be on newborn care at birth. Nursing care is very critical component of reducing newborn mobility and mortality. And the first few hours of life are most vulnerable period for a newborn, and it requires a skilled, immediate, and evidence-based interventions. So nurses play a very significant role in ensuring safe transition of newborn at birth. So the global perspective and importance. 2.4 million newborns die yearly and 1 million within 24 hours. So mostly preventable with simple and cost-effective intervention. So immediate care support, immediate newborn care is very important to ensure physiological adaptation of newborn and to prevent hypothermia, hypoxia, and infection, and also to improve significant survival of newborn at birth. So nurses play an important role in ensuring survival of newborn at birth. So here is a case scenario. This is a term baby delivered via vaginal delivery. The baby cried at birth. There was an immediate cry. Slight pallor was observed, and the ABGA score is 6 at 1 minute and 8 at 5 minutes. So we'll be talking at what are the priority nursing interventions. As nurses, what are you expected to do for this case? And what does the ABGA score suggest? We know that the ABGA score was 6 at 1 minute and 8 at 5 minutes, which is good enough. With this ABGA score, is there need for resuscitation? Is there need for a supportive care, which is the immediate care? So there is improvement from 6 to 8, from the first minute of life until the 5 minutes. After the 5 minutes, the ABGA score was from 6 to 8, which suggests that there is a positive response to initial intervention. The immediate care provided is good, and this child just needs a close monitoring. So here is the nursing roles and responsibility for newborn, for the care of the newborn. Nurses provide immediate care, which is the care of the newborn within 1 minute of life. Thermal regulation, this is to prevent hypothermia, providing warmth for the baby, drying and cleaning of the baby. Airway management, we've talked about neonatal resuscitation. So airway management to check, assess the airway. Is the airway patent? Is the child breathing? Breathing support as well. Vital sign monitoring. As nurses, you check their vital sign. You check the vital sign. Ensure feeding support as well. You initiate breastfeeding as soon as possible within the first 1 hour of birth. Medication as well. You're going to administer medications, vitamin K and immunization, and preventive care and infection control. These are just the roles and responsibilities of nurses for the care of the newborn. Also, the nursing role as well still includes safe cord care, clamping and cutting of cords, immunization support and education, family-centered care, parent education, which nurses play a significant role educating the parents, the mothers, and the caregiver as well. Emotional support, reassurance, counseling, accurate documentation of observations and vitals checked, early identifications of complications is very important, and timely escalation of care if any abnormalities are observed. So we'll be talking about the immediate care of the newborn, which is very significant. Golden minute approach. We're talking about the global statistics. Said 1 million deaths was recorded. Newborns, 1 million deaths was recorded, and only if the immediate care is good enough, which can be, this could have been prevented as well. So this talks about the significance of immediate care of a newborn. And the golden minute is still the first minute and the first hour, the first 60 minutes of birth is very significant in the survival of a newborn. And the first minute after birth is critical. So what are we doing in the first minute of care of the newborn? Provision of warmth. You dry the baby, provide warmth for the baby, ensuring that the atmosphere is warm enough. You switch off the fan, AC, just as my MD said earlier. Ensuring that the atmosphere is warm, the room temperature is warm enough for the baby, and dry immediately. Initiate skin-to-skin contact. Once the baby is born, you dry the baby. You can as well initiate skin-to-skin with the mother, and skin-to-skin contact between the newborn and the mother. You can place the baby on the chest of the mother while routine care and immediate care still continues. And as well, you're ensuring airway patency, ensuring that the airway is patent, and position the baby properly. And you suction only if necessary. You suction the baby if necessary. You assess the breathing. For baby that is crying, you already know breathing has been established. So you assess breathing, if the baby is breathing, if there is labored breathing, and if there is any abnormalities. You also observe chest movements, and you stimulate if apneic. When you are providing warmth, cleaning the baby, use a form of stimulation, just gently stimulating the baby to improve circulation. This helps improve baby circulation as well. And you initiate early breastfeeding within 1 hour of birth, and ensure that the baby is being breastfed by the mother. And administer prophylaxis vitamin K to prevent bleeding in the baby. You provide eye care, and at the same time you apply identification tag on the baby. Talking about the newborn assessment. Newborn assessment, this is a systematic and thorough assessment, and it's very essential. So you're talking about the ABGA scoring. You are going to assess the ABGA scoring, and what are we looking for? You're looking for the appearance. You're checking the baby's appearance. Is the baby pink? Is there pallor? Is the baby pale? So the baby is expected to, a healthy child is pink in color. You check for the pulse, the heart rate. Newborn heart rate should be within 120 beats per minute to 160 beats per minute. So you look for the grimace, the reflex irritability. Is the child responding to stimuli? And activity. How active is the child? Is the child weak? Is the child active? And you check for the respiration. Is the child breathing? And as well, you check for the respiration. For ABGA scoring, is on the scale of 0, 1, and 2 for the parameters being mentioned. So between 7 and 10, when you have a ABGA score of 7 and 10, it shows that the child has a good adaptation. That is a very good score. And 4 to 6, child needs support, might be immediate care, and the child can be in moderate distress. So you can provide immediate care, sunshine baby if necessary, provide warmth, stimulate the baby. And for 0 to 3, Apgar score of 0 to 3 shows that the baby needs urgent intervention, which the topic we've talked about neonatal resuscitation. This is when you perform neonatal resuscitate the baby. So severe distress. We're talking about the comprehensive physical examination of newborn. You check the baby from the head to toe assessment. You are looking for any abnormality. You are checking the baby from the hair, the color, the appearance, the hair of the baby, the fontanelle, if it's soft, palpable. You're looking at the face. Is there the eye? Is there any discharge? And at the same time, you're looking at the facial appearance. You do the head to toe assessment, and if there's any deformity as well, you assess the baby from head to toe, and you note the assessment and document accordingly. Also check the weight of the child. You check the weight of the child, you check the length and the head circumference, and you record it as well. You check the skin color and the reflexes, baby readiness to feed. The baby readiness to feed, sucking reflex, and as well being ability to grasp respiratory and cardiovascular status. You also check the vitals, you check the temperature, check the pulse, check the oxygen saturation, check the breathing. Is the breathing okay? Is the child the breathing, is there a labored breathing? So you do the comprehensive physical examination of the child, and you document and report any observation and any abnormalities as well. Infection control. Newborn are highly susceptible to infection. So as nurses, when caring for newborn, you ensure strict hand hygiene, which is very significant and prevents neonatal sepsis. So you ensure strict hand hygiene, wash your hand, and also educate the parents on hand hygiene before and after attending to the baby. So use of sterile techniques. While cutting the cord, you ensure that you use sterile scissors and sterile instruments. Proper cord care. Ensure that the cord is dry, is exposed, and ensure that there is no bleeding. Limiting unnecessary and visitors. Ensure that, and that's why vaccination is very important. You vaccinate the baby as soon as possible, and at birth, baby is supposed to take BCG, OPV, oral polio vaccine, and hepatitis B vaccine. And at the same time, that's after the immediate care. Still, the care of the newborn after stabilizing the baby, ensuring that you minimize handling of the baby and unnecessary visitors. Ensure early detection of signs, and you educate parents on danger signs, and observe the baby as well. If there is fever, hypothermia, poor feeding, and lethargy, baby is weak, that's so infection prevention and hygiene is very important. And parental education, which nurses play a significant role. Empowering parents improves neonatal outcome. So nurses play a significant role in educating parents on exclusive breastfeeding, telling them the importance of breastfeeding, how to properly position the baby while breastfeeding, what are the signs to look for to ensure that baby is latching well and baby is taking breast milk. Also, the nurse as well educate the parents on hygiene and cord care, even after discharge, how to care for the cord, even after diaper change, just to ensure that the cord is exposed and below the diaper. So recognizing danger sign, what are the things that when they see, they should report to the hospital? Difficulty when if they observe that baby is not breathing well, or labored breathing, poor feeding, baby, there is reduction in feeding, baby is not eating, or the breastfeeding, baby is not breastfeeding well, is a sign of, this can be a sign of infection as well. Fever and hypothermia, so you encourage them as well to have a thermometer at home to check baby's temperature. And the importance of immunization schedule, so nurses educate the parents on immunization schedule. At birth they would have given them the one that is required, and you tell them the follow-up visits. At 6 weeks they are supposed to come for their pentavalent, rota, PCV and IPV. So, and you let them know the importance of adhering to immunization schedule. So this is the assessment flow. Provision of warmth when a baby is born, provision of warmth, keeping the baby warm, this to prevent hypothermia and ensuring patent airway, baby is breathing well, and circulation, there is proper flow of blood. And so it's important for us to we follow standard neonatal protocol, which we've been talking about since the symposium began. Document all interventions accurately. Documentation is very important. I remember Dr. Akudo also mentioned this. We should document all interventions, all observations, all examinations done, medications given. Escalate complications promptly. When you observe any abnormalities, you observe any complications, you report, and maintain compassionate, family-centered care. You show compassion, reassure the baby, the parents as well. In summary, nurses play a life-saving role, ensuring early assessment and prompt intervention of newborn. Preventive care significantly reduces mortality, and parental involvement enhances long-term outcomes. So I'm going to close with this. Every second counts in neonate care. Your knowledge, vigilance, compassion can make the difference between life and loss. We've learned about neonatal resuscitation. It's expected that we'll take the knowledge and skill down to our various facilities to further improve the outcome of care of our newborn. Thank you so much.